international contacts with Sheba, including Canada, of course. So I'm honored to have them with us. And I believe that Kim Macmillan from the Simulation Center, the COO of the Simulation Center, has joined us as well. So I'm along the line of what you said, and Edmond, I really feel a family. Montreal is my second home. My parents made Aliyah to Israel in the midst of the independence war in '48. My mother was born at the Jewish hospital. And I have a lot of family in Montreal and in Northern America. So I really feel at home. And as you can imagine, the ties between Sheba at large and Messer in particular, Messer is the simulation center, and McGill in Montreal are very, very strong. I believe that Yoel and Enat and Professor Kreis, the CEO of Sheba, was over there in October, if I'm not wrong, last year. And we're looking forward to extending the visits and doing more together in the coming year, hopefully after the Corona crisis is over. So with that said, I think that the opportunity here to share with you a little bit of where Sheba is as regards to the Corona crisis is a very unique story. I think we are very, very proud that Sheba is on the cutting edge of the Corona battle, certainly on the Israeli front, but I would argue humbly that it's also true about some of our international friends worldwide, because we have taken action as regard to the Corona challenge very, very early on. If you may remember, Sheba, there were about a group of Israelis on the Princess Diamond in Japan at the beginning of the outburst. And we at Sheba made the decision to host them on their return to Israel. So that brought us to make the decision to build the first Corona compound in Israel over 50 days ago. We're talking about almost 2 months ago. We were up and running with Corona friendly, so to say, environment that was able to deal with the Corona challenges. And in fact, perhaps as I'm doing so, I'll share with you a very short presentation that we prepared on the Corona and Sheba story. And you will be able to see both the presentation and myself and the whole group. So you may remember that Sheba now changed its name to the City of Health, pretty much the largest hospital in Israel, one of the largest, I believe, in the Western world. I'm not comparing us to Chinese hospitals, but certainly to Western world hospitals. And we are trying to inspire the world. And the visit some 6 months ago in Montreal was all about the future hospital meeting that was hosted by McGill and Memorial Hospital. So in that respect, that was discussed over there. That was our initiative. As you can see, Sheba was announced exactly a year ago to be one of the top 10 hospitals in the world. And a few weeks ago, during the coronavirus crisis, we were once again announced to be on the top 10. We in fact made progress, and we are now top 9 hospital in the world. And it's certainly a lot because of the inspiration and the work that we've been doing in Israel over the last 70 years. And some of it, I think, is really reflected in the way Sheba started to deal with the Corona, which really much shows the cutting edge activity that takes place here at Sheba. So some of you may know that Sheba was born with a birth of Israel as a statehood in '48. On the left-hand side, you can see the barracks of the British mandatory regime that were built as a field hospital for the potential invasion of the Nazis during the Second World War. Luckily, they never reached Israel, but this was a hospital that was ready to take over, and we took it over in Israel as the first military hospital that then became the first government-owned hospital. That was over 70 years ago, 72 years ago. And if you see on the right-hand side, you can see Sheba, city of health of today. It's a huge hospital in all figures, very much well-known worldwide. And in terms of numbers, it's the size of Mayo Clinic and very few other hospitals in Northern America. We have about 2,000 beds, hospitalization beds. We have over 1.5 million clinical visits a year. We have almost 10,000 healthcare professionals, employees who work with us, almost 12,000 deliveries a year. A huge work on the startup nation, as you can see at the bottom. Over 100 startups are working at Sheba, with Sheba. Many of them are related now, these days, with the COVID-19 challenge. And we're running about 25% of Israel's clinical trials and research on the healthcare front. So Sheba is really a mega powerhouse on the medical side, research side, with almost 200 PhD researchers only at Sheba. So we're the size of a university. And the next in size hospital in Israel is less than 50% of our size. That would be Rabin or Hadassah, the two hospitals. So it's a huge hospital. And as the COVID-19 approached Israel or started to disseminate itself outside of China with a Diamond Princess ship and the people on board, Sheba was very much the first in Israel to take over the preparation to deal with the COVID-19. You can see here on the left-hand side, it's in Hebrew, but that is the special unit of Sheba to deal with disaster situations. It's the disaster management unit of Sheba, which took over and built the first department on the Sheba premises to deal with the COVID-19 patients that were about to come. Initially, we ran it only for those who came for isolation, but soon after, Israel started to deal with real corona-infected patients. And with that place on the left-hand side being a site for about 40 patients, we went on and built a whole hospital for corona patients. This is the one over here, with about 300 beds for corona patients. Many of them, almost all of them, can accommodate ventilated patients. We've done the same underground over here, the critical care corona unit, which is almost 100 patients, beds for intensive care patients. I'm talking about the most extreme patients on ventilation. And we are the first in the world. At the moment, I believe that we are the only one in the world that built a psychiatric corona care unit to deal with the psychiatric patients from all over the country that might have the bad luck to not only have a psychotic attack, but also to be corona-infected patients. So as we speak, I'm talking about a site in Israel, Sheba Medical Center, that since 50 days ago, a little bit over, we have dealt with over 300 corona patients thus far. These days, we have about 100 patients hospitalized by us. Third of them, almost 30 of them, are ventilated in intensive care condition. And the rest of them are in the other compounds that I just mentioned, in different levels of severity. But more and more, the level of severity goes up and up to the medium and severe level, while those patients who are on the more mild side or almost asymptomatic initially were with us. Now most of them are in hotels in Israel, and outside at homes, etc. Israel today has about 10,000 infected patients, and Sheba is way ahead of the curve in terms of treating them. Most of the hospitals in Israel have less than 40 patients at a given time. We, in our peak, had almost 150. So Sheba has gained huge experience in the field of coronavirus battle. You can see here Litzman, the Rabbi Litzman, who is Minister of Health, now in isolation, and the Prime Minister Bibi Netanyahu visiting us on the first site. You see here the first patient that came over, and we have applied during those 50 days technologies that are, most of it is Israeli technologies of telemedicine, of telemonitoring, with all kinds of Israeli inventions that allow us to minimize the physical interaction with patients while providing them a very, very sound and high standard healthcare with COVID. And we've been running it throughout those days with a lot of simulation training, based training. This would be a patient who is a simulated patient, an actor. And a lot of the training took place before we actually opened each of the compounds I mentioned before. So these are a few photos of the technologies. You can see here the underground area that we built. In less than 1 week, we had an underground hospital of almost 100 patients, ventilated patients capacity. We're about to finish another underground hospital to finish construction of about 200 more beds for underground hospital for those patients that might come, hopefully will not come. We've been using monitors, distant monitors with hundreds of cameras, with robots, Israeli robots that were sent into the battle to deliver monitoring parameters from patients and to actually talk with patients on our behalf from far away. And we have invented, as this epidemic or pandemic started to kind of evolve, there was a huge need to invent more and more solutions that were from scratch because none of us worldwide was ready for the battle. So as we invented all those protocols, I want to share with you very shortly the way we've been doing it with the Simulation Center. You may have heard about the Israel Center for Medical Simulation. It's called Meser in Hebrew. In Hebrew, it means Medical Simulation Center, Merkaz Simulatzia Refuit. But you would also agree, the Hebrew speakers in the audience, that Meser is a value of message. The value message is, let us be better prepared, better trained before we actually do the actual sacred word work of healing. So Meser was the first simulation center that was built as a national sim center at Sheba, obviously. And we built it about 2 years ago, 20 years ago. The second in line, just for you to know, was McGill. Arnold Steinberg and the McGill Medical Center built a simulation center with us being their consultants. And your brother, Edmond Henry Elbaz, came over and he built a small simulation center at the Jewish hospital as well. So a lot of this know-how came out of the Holy Land and Sheba and Israel. So just to give you a feel of the type of work that has been done, still being done at Sheba for the whole nation, not only for Sheba, but obviously Sheba was the main body that worked with us on the simulation. So it's a 1-minute video clip, which I'll just show you very briefly, and I think we should then open it up a little bit for a question and answer, if it's fine with you. So have a look. It's a 1-minute clip that gives you a feel of what we've been doing. So I want to go back to the screen and share with you in a few more minutes just the concept of what was the real challenge. You can imagine that none of us health professionals worldwide ever experienced the work under those protective gear conditions. None of us had the psychosocial challenges of talking to patients behind the screen or from far away, or alleviating anxiety of families and of patients via remote communication, and not to mention, of course, tele-psychiatry or telemedicine or tele-intensive care. A lot of aspects that were never really tried out before by mankind. And as we started to deal with all the challenges that surfaced again and again, it was obvious that the strength of any hospital is not only by actually bringing technology in or constructing amazing construction in no time, and that was unbelievable done at Sheba, still being done at Sheba. It was all about, at the end of the day, human beings acting in these circumstances in a manner that is effective, humane, sensitive to patients, sensitive to families, sensitive to staff, that needs to be to trust the environment where they work in. And these were all challenges that we were dealing with as we started to work with the first patients. And what we've been doing over those 50 plus days was, while working with patients, we were learning and writing the protocols and training ourselves via simulation on each of the protocols, improving the protocols. We'd never had the right solution day one. We had to really do things in a dynamic way. And what was very strong about it was that not only that we use simulators, mannequins, computerized mannequins that you can ventilate and really deal with extreme clinical scenarios. We also utilized a lot of actors that role played the patients with the fear or the family member. And we trained our psychosocial staff, psychiatrists, sociologists, and psychologists on how to actually work around the anxieties that surfaced, and they're still there. So it was something that I don't think that any other country in the world has taken it in as a I would say comprehensive approach that was dealing with all elements of this pandemic. And we were very proud, and still are very proud, that we became a hub for all Israeli hospitals who came over to learn from us. We trained via telemedicine many of the Israeli hospitals, or trained their trainees or trainers. Not only that, we are still training the Palestinian Authority. We've worked with the Palestinian Authority from day one on how to build their COVID-19 compounds, how to train their people. All our materials have been translated to Arabic, all the materials. And it's something that we believe that, the healing battle is so much stronger than the killing battle, so to say. And it's something that really built more and more trust among us here in the Middle East. And a lot of webinars have been run by us worldwide on all kinds of inventions that Sheba has been involved with, new ventilators, new telemonitoring, etc. So in a nutshell, I've tried to share with you a lot of the activities that have been done. But at the end of the day, I think part of the reason why Israel is in such good condition, with less than 1% death rate, while Italy is above 12% death rate, with about only 100 patients who passed away, most of them in the very elderly age group, with about 10,000 Israelis who have been infected, but most of them are in good shape at home or in hotels. Part of the good statistics on the Israeli side has to do with Sheba's leading role all along, and the way Sheba approached it with the simulation and with the training and with the understanding of the challenges as early as possible, and building capacity that is way beyond at the moment of what was needed and utilized thus far, which is exactly the opposite of what happened in Italy, for example, where they reached their full capacity in a few days and they were in a complete disaster in the first week of their battle. And ever since they are in this status. I think I will stop here and open it up for your questions if there are any.
Okay, so please, whoever has a question, just raise their hand. And I will pass on. There's a lot of people. So if you have any questions for the doctor, please raise your hand and I will just unmute yourself, or if you can't, I'll unmute you myself.
Okay.
Okay.
Okay, go ahead.
Am I on? This is Arlene.
Yes, go ahead.
Hi, good morning, Professor. I'm Arlene Habitant. I live in Montreal, of course. Thank you very much for your conference. Just want to know about the hospital. You are a treating hospital, right? Do you do any research as well?
Yes, we're doing a lot of research. And before I even touch upon the research, I want to remind ourselves that we are a hospital. So yes, when we are talking a hospital, we are not only a Corona hospital. While we're running the Corona efforts that I shared with you, at the moment 100 patients, but we have capacity at the moment of 450 and soon 600, the Sheba Medical Center keeps on doing regular healthcare duties. So all our units, OBGYN, cardiac, rehabilitation, psychiatry, the non-Corona services are up and running. And we're very proud, you know, at the end of the day, we don't want to lose patients because of not being treated with strokes or myocardial infarct, etc. So Sheba, as we speak, is all the time working on the balance between the Corona needs and the non-Corona needs that are nevertheless as important as the Corona needs. So that's just a reminder that it's something that we know, for example, that in New York, for example, some of the leading hospitals had to give up on the non-Corona activities and completely devoted themselves to Corona. And I believe that we at Sheba and in Israel at large are still lucky enough to be able to run them both. Back to research. Yes, there's a lot of research that takes place at Sheba. Part of it has to do with new drugs. And practically most of our patients, as we speak, have been put on IRB, on protocols that are research protocols to look into the right regimen at the moment. There have been a few drugs that were identified, like anti-malaria drugs and others. I don't want to go into details, but generally speaking, we are not just trying out drugs. We're doing it in a manner with placebo and with protocols that are sound, research protocols, so that we'll be wiser, hopefully, in the coming weeks to see what is doing better, because at the moment, a lot of anecdotal evidence coming out in research, in publications, none of them is a strong evidence about what exactly is the right drug to do. So that's the research on the drugs. But there's a lot of research that takes place on inventions. that might be helpful in other aspects of the disease. And a lot of collaborations with many industries in Israel, startups or large industries like the Israeli aviation industry, the Israeli Elbit and others, and Microsoft is working with us. We have a lot of collaborations with bodies, global bodies, and of course local bodies. And also, I was just reminded, it's a very important one. We are now running with Microsoft a huge study that McGill is part of it. Sheba and the Simulation Center is the lead body. McGill, I believe that Thomas Jefferson, Henry Ford, and Mayo Clinic, these are the 5 hospitals that are working with us on a study on what is called HoloLens. HoloLens are the virtual reality devices, the newest in the world by Microsoft, that will allow us to do a lot of remote training and teaching on how to use a ventilator, for example, or how to deal with a specific critical event. And we are now building that, and Jerry Fried, you know, Gerald Fried from McGill Hospital, General Hospital. Professor Jerry Fried is a simulation expert and chief of surgery in the past. He is working with us on some of those protocols on simulation-based HoloLens.
Please, Dr. Bechor, would you like to?
Yes, I think that was an excellent talk. And I just wanted to ask a few questions. How many patients in the ICU at the present time? And do you have enough ventilators at the moment, or are you running short? And second question, I have reviewed all your articles on the simulation-based training, and one of them was in 2017 about improving end-of-life program. Is this in a way has helped the medical staff in dealing with situation like this?
I so much appreciate both your questions because they are very much relevant to what we're doing today. So I'll get back to the end of life in a moment, which is extremely relevant, the palliative care and the readiness to convey to patients and families, you know, the limitation of this condition. But back to your initial question, we at the moment have 30 patients on ventilators. There are patients that were admitted throughout the 50 last days. We're very proud that thus far we have 2 patients that were already extubated, meaning not anymore on ventilation. We have a unique, the only one in the country, unit at our rehabilitation hospital that is all about breathing rehabilitation, meaning weaning off a patient off a ventilator. We have a lady, 26 years old, who collapsed after delivering with the coronavirus. Baby is fine. She collapsed and she went into the intensive care some 3 weeks ago. And 2 days ago, we extubated her. She's back on her feet, talking with her family, and back with us, completely healthy. We're waiting for a corona checkup to be negative, and she'll go back to her family. So we have a few such patients who are doing better and better. And believe there's a lot of need for rehabilitation after 3, 4, 5 weeks of being ventilated. So we expect that the rehabilitation hospital will start to do more and more rehabilitation of patients that were announced corona-free, but yet after being 5 weeks on a ventilator, they will certainly need a lot of rehabilitation. And Sheba has that ability to go from the acute care, heroic care, all the way to the bringing back the patients to functional life. So 30 at the moment. We lost over the last 50 days 6 patients, all of them close to the 90 years old, somewhere between 80 and 90, which is similar to what happens worldwide and in Israel in general. We have women, as I mentioned before, after delivery that were corona positive. We had quite a few surgeries that we had to do, operations on patients, neurosurgical operation, orthopedic operations on patients. So we learned how to do those under corona situations. The psychiatric story is a very unique one. So we are in a good shape as regards to the intensive care, and we have, as I mentioned before, a capacity of intensive care of almost 100, and a medium care, step-down intensive care, still ventilated, of 300 more beds. At the moment, only 100 and only 30 are ventilated, meaning that we have a huge capacity. At the moment, we are not short of ventilators. Sheba at the moment has about 150 ventilators that are ready to go if needed. And as we speak, we are dealing with inventions that would transform some non-invasive breathing machines, like it's called BPAP, never mind, into a ventilating machine. We just received today, Yoel, the lung simulator, just arrived this morning. We're the first to have a lung simulator, which will allow us, Yoel was instrumental in us bringing that simulator from Norway. And this simulator allows us today to do a lot of research and development of alternative to the traditional ventilators, to the point that we could increase capacity of ventilating patients with machines that were not meant to be ventilators, but will be transformed. This simulator now allows us to do so. So there are few Israeli groups who are doing that. So in Israel at the moment, there is no shortage of ventilators, but we are still building capacity for, a potential catastrophe. We hope that it won't come, but a few weeks from now, about 10 days from now, we will be wiser about how good did the Israeli society behave during the Passover, Seder Pesach. If we behaved well, and we believe that we did, including the Orthodox religious communities, then we believe that we will not reach that extreme scenario. But that scenario could be still a serious one, and we're ready for that with huge capacity. At Sheba, the largest capacity by far, but Israel in general is in a good shape. As regards to a question about the end of life, we have a palliative care unit at Sheba, a very strong one. We have been training at Messer, the Sim Center, thousands and thousands of Israeli physicians and nurses, social workers, spiritual support staff, and others on how to communicate end of life and discuss those very delicate, sensitive aspects of advanced directives and patients' preferences, patients and families, some of them. And we have urged our staff from day one to do those discussions. And rabbis were part of it. Rabbis do appreciate the option of not necessarily putting patients on ventilators, which could be a heroic procedure, but with zero potential of recovery for some patients, not for all, of course. So yes, that experience at Messer and in the country has been extremely instrumental. And we've done training with simulation. You might have seen it in the clip that I showed you before, where families on one side at home, not being able to be physically with us, are discussing with our psychiatrists, psychologists, social workers, this very issue of end-of-life preferences. So yes, we are much more ready, I think, for those moments. And we have an ethical committee that has dealt with a few such events thus far. Yes.
Okay, thank you very much, Doctor. Anyone else, please, right here? Yes, go ahead, Andre.
I have, thank you very much for your presentation. I think it was very good. The previous chief of radiology at the Jewish General Hospital. And as you know, the Jewish General Hospital is the first and main hospital in Quebec for dealing with COVID patients. I have 3 questions for you. The first one is, how advanced are you towards obtaining a vaccine? The second one is, if you can elaborate a bit on the concept of herd immunity and if it has a place in the management of COVID cases until we have more definitive treatment. And the third question is, what's your experience with the use of chloroquine or hydroxychloroquine? Thank you.
So thank you for that. First of all, I'm really proud to hear about the Jewish hospital taking a lead in Montreal and beyond. Or is it the Montreal main site, the Jewish hospital? That's what you said?
Main site, but there are others now because there are too many patients, but the Jewish was the first hospital to deal with these patients.
To take over. That's very impressive.
The results are pretty good.
Very impressive and not surprising that you took over. First of all, the story of vaccine. There are plenty of groups worldwide that were working on the vaccine. There are a few groups in Israel as well, national groups, not necessarily Sheba-based groups. I know that some of the Sheba researchers are part of that activity. It's being done worldwide, huge competition between China and the US and others, Europe as well, Germany. As we all know, I don't have a full answer. All we know at the moment is that vaccine will most probably take more half a year at least, if not a full year. All kinds of statements have been heard over the last few weeks. Vaccine is a long shot that will happen, we know that. But how long would it take? I'm not in a position to give a good answer. I'm not sure any of us at the moment is in. There are some clinical trials that are taking place at the moment, not in Israel on vaccine. This I can tell you for sure. As regards to the second question was remind me. We don't hear you now.
I'm sorry?
The second
Now
question.
Herd immunity.
Herd immunity. As far as I understand, herd immunity was not really done by a few countries, Sweden, for example, was taking that direction initially. They all abandoned this direction. It takes too long to go for herd immunity. Too risky, apparently, and certainly very difficult to isolate populations at risk. So herd immunity, if at all, it will become a secondary, natural process that takes place. It certainly will take a year or so before it will be effective. And I don't think any government worldwide has decided to go that way as a herd immunity. It will be a byproduct of the fact that there is a herd and there is immunity that takes place by people, interacting with each other. I think it's a very, very risky approach at the moment, and I think even the Swedish people have decided to abandon this concept, and they're paying a big price at the moment on allowing populations to be physically with each other. So I think that most of the world, including Canada and Israel and others, have taken more or less the same approach of isolation and all the protective approaches that we all know. We are all with masks. At any given day, we are all using masks. We exchange the mask every 6 hours, not every 12 hours. All our patients are with masks. All our patients with masks. We are with masks. and there is very good evidence that those are much more effective approaches at the moment to stop dissemination or to minimize and allow us kind of to not reach those peaks that that really collapsed European countries and maybe these days US as well, New York at least. As regards to the chloroquine or Plaquenil, apparently there's a lot of anecdotal evidence, you know, one case here, one case there, a group of 60 cases in New England a few days ago that were published. And it doesn't seem to be at the moment to be firm evidence that this is doing the job. This is why we decided to go with 3 arms, 3 drug-driven protocols. One of it is the chloroquine, Plaquenil, and placebo, and another one with the azanil, you know, and other antibiotics to go together. So there are 3 arms in that one. And there are 2 other arms with other drugs that we're using, such as anti-HIV and others. But at the moment, Sheba has decided that the literature out there is not strong enough, not the one that comes out of China or Italy even. Most of these countries have done trials and errors without a sound research protocol, without placebo, with all kinds of compassionate care attempts. And at the moment, unfortunately, 60 days or not more than 60 days, 3 months into the pandemic, with all due respect to the many published articles, it doesn't seem that we are on any solid ground on what is the right regimen at the moment. So back to your question, we are trying out Plaquenil, but we are not yet sure that this is the one that does the work. We will be wiser, we believe, not alone, with the whole world, obviously, when those protocols will be running. In Israel, some of these protocols are being conducted as a multi-centered study, with a few hospitals working together.
Thank you, Dr. Lisbona.
Thank you.
Please, Dr. Jackie Cohen has a question. Please unmute.
Hi there, question for you. Are we doing any treatments for COVID, looking into acetazolamide and other things that we use to treat high altitude pulmonary edema?
Not that I'm aware of, and I'm certainly not an expert in intensive care and in those pharmacological options. So I may not know, and it might be true that it takes place. So I'm certainly not the expert to give you an answer. I have not heard of this direction at the moment. I'm very proud to share with you that in the upcoming Independence Day main event of lighting the torch on Mount Herzl, we are honored that day, Professor Galia Rav, she is the chief of infectious disease department at Sheba. She will be lighting a torch, one of the 12 torches. She is the leading lady in Israel these days in those trials that relate to new drugs or new combinations of protocols. And she is certainly the one that could answer this question better than me. That very day, by the way, of the Independence Day, the evening has that event with a torch, and the day after we have the Israel Prize event, where Sheba is very proud to have our chief oncology researcher, Professor Gidi Rechavi, to be awarded the Israel Prize on his work on oncology research. So it's up and coming, what, two weeks from now, that Sheba has those 2 leading professors being awarded accordingly. But your question, I don't have an answer to it. Sorry for that, Jackie. Yep.
Jeremy, please, question.
Yeah, Am I unmuted?
Yes.
No, yeah, we
I'm
can hear
good.
you.
Thank you. Thank you so much for the presentation. I don't know if you perhaps touched on this. Does the MSR lead or at least see a role for simulation-based training beyond frontline hospital staff training to other aspects of public health to, say, simulate the mobilization of external resources, wrapping up testing and contact tracing, public health clinics like in Singapore, telecom, first responders, and so forth?
Oh, absolutely. We are very much in those levels of training and simulation. I'm on a webinar on this coming Wednesday. It takes place on the second Chag with the WHO. Myself and the head of the disaster wing of Sheba, the international disaster component. WHO is very interested in the way we have been working on those aspects of public health and beyond. And there's a lot of sharing that we already do. We will do it on Wednesday as well with WHO. We, by the way, have the whole spectrum of training from, the individual health staff member to be trained with simulation on how to protect himself or herself with the protective gear. That's, the basic one, all the way to the team training of intensive care clinical work, all the way to the psychosocial. But all the hospitals that I shared with you before, the ones that we opened, the Corona Hospital, the Psychiatric Hospital, the Underground, the Intensive Care, all of them, the training was not taking place at the simulation center. It took place on site by our staff running it as a system check, we call it. We ran the whole system before we even had the first patient coming. So that was kind of the more comprehensive training from admission to discharge to recruiting additional people and to discussing with families far away the bad condition of a patient. And that's true. So we went all the way to that level, and now we're working with the Ministry of Health on disseminating a lot of this know-how across the country. And as I mentioned before, we're doing it with the Palestinian Authority in Arabic. Eastern Jerusalem hospitals have been trained by us. And in that respect, your question is great. I mean, you can take the concept of simulation and take it to any size. Some of it would be more cognitive, some of it will be more action driven, but it's all about trying to kind of be prepared for the scenarios before they actually happen. And I think that was part of the strength of the Israeli approach. We were really preparing ourselves to the worst, and at the moment the worst has not yet come.
Thank you. Alan Daly, you raised your hand. Please, your question.
Hi, Dr. Ziv. Is really Gilad one of the most advanced towards creating the vaccine? Gilad research.
Gilead is certainly on the cutting edge. They are also the ones who came up with their Remdesivir, if I'm not wrong, that's how you pronounce it. We've been using that drug twice already. That's the compassionate drug. We're using it as compassionate drug, not at the moment as real protocols. We don't have enough of that drug. It's Gilead is not releasing enough of it. But I'll share with you that I believe that the lady after delivery, the 26-year-old, she received it. Another one in Perea Hospital received it. We now have a 5-week-old baby that was infected by his grandmother. And we received a dose of that drug from them. Luckily, we decided not to use it, because luckily the patient, the little 5 weeks old, indeed was infected by COVID-19, but that was a side story. He came to us with bacterial infection, a septic infection. He's responding well to antibiotics. So the story of the corona is completely not the issue, and he's improving himself, that little boy, without us needing to give him that compassionate drug. But we had it ready to go. Gilead seems to be on the cutting edge, but I can't tell you much more about that. Gillian.
Thank you, doctor. Anyone else with questions? Please unmute yourself. Yes, Dr. Bechor.
In Canada now we are giving on trial, started giving a plasma from patients who were infected with COVID-19 and recovered because it's supposed to be rich in antibodies. And this is being examined as a possible treatment to produce immunity. Any comment on that?
Yes, so absolutely. Thank you for reminding me of that, what seems to be, the most logical, ultimate treatment that we can give at the moment, because in Israel, out of the 10,000 infected Israelis, about 1,000 of them, only 10% at the moment, have been declared as healthy, COVID-19 healthy, meaning that they have antibodies in the blood that could be helpful. So I'll share with you a very, 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 I think, exciting story. We have one of our patients is a chief nurse in one of our departments. She's in her 50s, not too old, and certainly, one of the very well-known nurse among us at the Sheba staff. She's very badly ill. She is fighting for life. And a few days ago, in fact, during the Passover night, it was clear that we need to give her the most, not only her, any patient who is in that condition, but she was symbolically the first to be in such a grave need. And we started to look for the right donor, potential donor, who happens to be the husband of the husband of our emergency medicine resident at Sheba. That emergency medicine resident luckily was not infected by her husband, but the husband was. He was hospitalized at Sheba. He was one of the first to recover and to go back home to his wife and children. And as we approached him, because he had the right blood type for that lady, he came over in the middle of the night. We did plasmapheresis, and she received that plasma, I believe, 2 days ago. She is the first. Hadassah also did one such event. So I think in Israel, there are only 2 patients that received plasma with those antibodies. And as we speak, Sheba is put all our resources to do plasmapheresis on a national level. All those 1,000 patients who have been declared as recovered patients are now being mapped by Israel at large, and Sheba is doing a lot of it. And we are starting now in Israel, and Sheba will be a leading body to do so, to build a bank of plasma antibodies for the patients who will need it in the future. That lady, unfortunately, at the moment, I may have not heard any update today, but yesterday when we were updated, she wasn't yet responding, but it might take a few days, obviously. But we're praying to God that will be the game changer. But yes, this is where all of us are at the moment, trying to do the more with the plasma and the antibodies. Absolutely.
Thank you, doctor. Mr. Gabay.
Okay, thank you, doctor. I just would like to know, are you playing a part in discussions of reopening the Israeli society?
The Israeli society I believe that Canada is in a similar condition to Israel to an extent, but certainly at the moment, everybody realizes that we might win on the corona battle, but we are paying a huge price at the moment on unemployment and the crush of the Israeli economical system. And it's a very fine line between the government politicians and experts out there around them as they discuss when to open, what to open, how to open. We call it the exit plan, right? How to go out of this condition. If you ask me about to what degree is Sheba part of that discussion, to the extent that Sheba's experts have a say, and we do. But I would argue that it's being done at the level of the Ministry of Health and the Ministry of Economics and the Prime Minister personally and others. Huge battle with many, many stakeholders. I think we will be wiser after the second holiday or next week, let's say, to see how Israel starts to open itself up. We, anyway, have decided that Sheba to put more and more effort and focus on opening up Sheba as a non-corona hospital and encouraging patients to go back to doing medical screening and to not ignoring the chest pain and to not ignoring, obviously, the need to do biopsy or any screening that they were somewhere in the pipeline. And I think we will start to see that happening sooner than later. I think Israel is in that, it's my personal view, and I'm not in that position to make those decisions. Israel has the privilege, because of the good work that was done thus far, to start to open up in a very delicate, balanced way aspects of the economy, industry, education, and we cannot afford to extend that model, that mode of isolation beyond what is needed. I think we'll be seeing it soon.
Thank you, Doctor, for your patience and for your answers. We'll take two more questions from Mr. Hadid and then Sandra Mashal, and we'll wrap it up with a few words from Inat. Thank you so much. Mr. Hadid, go ahead. MH, I'm sorry.
Oh,
I thought that was Hadid.
how do I unmute it? Am I unmuted? Hi, I'm Monique Hanono Vidal. I'm
Sorry.
on the call from New York. Thank you, Danny Sharabani. So I had two questions. It seems like the COVID-19 is behaving differently from other viruses, and a lot of doctors are speaking that the ventilation setting should be different. It's not behaving like the typical ARDS, and they're advocating lower pressure ventilations or trying to delay ventilations. Do you have that experience in Sheba also?
Oh yeah, indeed so. I mean, there is, and again, I'm not an intensive care expert. I'm a pediatrician in my medical profession, but not intensive care. But yet, absolutely, it was mentioned to be ARDS, but apparently it has some unique features of ARDS that are different. For the lay people around us, ARDS is an extreme scenario of lung collapse. And there's a lot of webinars on that. What we learned, and that's the approach that we are doing more and more, is that we are going very early on for intubation, very early on afterwards for coniotomy, for tracheostomy, meaning intubation via the trachea rather than the mouth. And we have taken that approach, and it seems to be working well. One more aspect of that unique approach, and that is the prone position. We do put our patients on the belly. That's called prone position. It shows to be extremely effective, improves their saturation or oxygenation. One of our inventions at Sheba is a prone machine, a machine that helps us, instead of 6 people taking a patient and maneuvering him from the back to the belly position, to the prone. We have a machine that was invented by one of the Israeli startups to do it almost automatically. We have 3 such machines, and it's very, very helpful as we move along. So yes, it's not ARDS exactly as it's written in the books. It behaves differently, and our teams are studying it not only on our own experience, but with all our friends from Italy and from other places, France. We are very much in touch with many, many physicians worldwide, all the time. On a daily level, we have those webinars to learn what they learned and what we learned, and to share that experience all the time.
Thank you so much, Dr. Sandra Mashal. Let me unmute you. Yes.
And it was very informative, but my question was, when do you think Israel is going to be going back to normal? And you just answered that before, but thank you.
Okay.
That's true. And as I mentioned before, I don't know. The main answer is that I don't know. I can hope, but I really don't know.
Einat, please, thank you so much, Doctor, for your time and for a very informative presentation, very elaborate answers. Einat, you want to wrap it up with a few words to share with the community?
Yes, thank you, Rabbi Pinto, and thank you very much, Professor Amitai Ziv. It was phenomenal, and really, thank you. It was great.
I appreciate the opportunity. Thank you so much, Einat, and everyone.
So I would like also to thank all the Montreal community members, and first of all to Daniel Sharabani that took the lead on this beautiful Sunday morning. Thank you. And Ron Mashal for making the call and checking if we can do it over a few days. And between we had the Passover. So yeah, we made it. Thank you everybody for putting your time and effort, and Jeremy and Edmond for hosting us. And I have to tell you that here in Toronto, we have a group of Canadian Friends of Sheba, and we try to support Sheba as much as we can and to bring the awareness to the beautiful work that Sheba does in Israel and around the world. And I can say that it's kind of Or Lagoim, what you are doing, and it keeps us very, very proud. And hopefully in the future, we can bring you, Professor Ziv, to Montreal physically to meet the great community that we have there. And
I'm looking forward.
Yes,
We
yes.
would love that.
And to meet everybody in person. So thank you so much for your time and for hosting. And we hope to be in touch soon. Thank you.
Thank you so much. Chag Sameach to everyone.
Chag Sameach, Doctor. Chag Sameach, everyone.
Chag Sameach.
Be safe.
Normal very soon.
Be safe and healthy.
Thank you.
Take care.
Sameach, everyone.
Bye-bye.